I'm Rebecca with the Managed Care Resource Alliance, and I want to welcome you today to the CAG Quarterly Digest webinar. In our quarterly webinars, our subject matter experts will discuss some of the key trends and activities happening in the market and how they impact the complaints, appeals, and grievance function. Today, we have Danielle Chenal and Margaret Crowley from Inspire Innovations and Caitlin Potozak with CAG Solutions. First, just a few housekeeping items to discuss. The webinar is being recorded, and we'll send the slides and a link to the recording to all attendees after the event. If you have any questions, please know that all attendees are muted, but you may submit any questions through the online chat. For today's agenda, the team is going to discuss some key trends along with actionable takeaways, and our focus topics this quarter will be about changes in the STARS ratings. Now I'm going to pass it on to Danielle and Margaret.
Great, thank you, Rebecca, and good morning, all. As Rebecca said, I'm Danielle Chenal with Inspire Innovations, and I want to thank you all for joining us. Great, so I'm going to start out with some market trends, and this first slide talks a little bit about a study that was done by ATI Advisory. It was done for the Better Medicare Alliance Advocacy Group, and it found that Medicare beneficiaries on average save about $1,640 on their health costs annually. And that's pretty significant in that this is kind of just evidence that Medicare Advantage plans continue to prove their value. In this slide, you could see a couple things. So first, there's a 2.5% growth rate that's been occurring, and it's projected to continue to occur. And that cost savings, along with innovative benefits and clinical models are kind of driving, I think, this continued growth in enrollment. The other thing that's notable is that as of 2021, 42% of the 62 million Medicare enrollees are enrolled in a Medicare Advantage plan. So some predictions for the future. I've read a couple different studies, and in this particular one, it shows that half of those 62 million enrollees will be enrolled in a Medicare Advantage plan by 2025. I've seen some that show it as early as 2023. And a couple other trends you see in these slides. One, that the growth is a little disproportionately occurring in for-profits versus nonprofits. And there is also, while a small percentage of the market, there is a growth occurring in the venture-backed plans. So, with opportunity comes competition. Right, so we see that in this study. This slide talks a little bit about a letter that was sent by Medicare Rights.org to the new 117th Congress. And while this is just a subset of some of the things that were found in that letter, that article, these are some of the things that this advocacy group is recommending. So one is to reinstate some of the plan guardrails. So over the last few years, some of the rules have been weakened, especially from their definition, and they would like to see more government oversight, especially around quality, benefit design, and marketing. And then the two really relevant to appeals and grievances, one is in the reduction of inappropriate denials. And we're going to talk a little bit about that in auditing. We see a focus by CMS in terms of auditing there. And then the second one was updating the appeals process to try to simplify it. We all know how complex and cumbersome that process is. I don't really know what will come of it. I did read another article that they were suggesting that first level appeals be sent to an IRE. That doesn't seem terribly practical to me as a way to simplify the appeals process. So hopefully some other ideas will come out of that.
Yeah, Danielle, I just wanted to reiterate, I agree. I was speaking to some people about this, and it just seems it's just a big undertaking for one entity to do that. So I agree, it's really not manageable.
Yeah, thanks. Yeah, I think the volume would just prohibit it from being practical. But hey, got to keep coming up with ideas. Certainly, it could stand to be simplified. So I don't think anybody disagrees with that concept. And then, of course, CMS audits are back. So the rigor of CMS audits will start to occur again. We all know that due to COVID in 2020, CMS really limited their program audits, and we expect to see them come back in all their rigor. And we're already seeing that. Margaret and I, with some of our clients, are already in the midst of audits or completing audits. We know that that's coming if it hasn't already happened. So I'm going to talk about some takeaways from some of these trends, right? So let's start with the auditing. So if you're a little rusty, if maybe last year, you took a little break from this, we all had a little reprieve. Conducting mock audits is always a good way to get back into the swing of things. And then looking for ways to optimize your CAG system with regards to reporting. And I'm going to talk a little bit about that later because it's relevant to STARS, it's relevant to a lot of things, but making sure that the data validation in your systems is good. Making sure that what goes in, is correct, right? Garbage in, garbage out, right? So if you can make sure the data is going into your system right, it'll go out into your universes correctly. And then taking preemptive actions on some of the common audit findings, which Margaret and I are going to talk a little bit about. So the first one is letters, letters, letters. We tend to see issues in letters. In this particular case, a common audit finding is in the denial letters, having inadequate rationales, having information that isn't specific about the denial, and or having language that isn't easily understandable by the member. So that's some of the common audit issues that are found. And so Margaret, maybe you can tell us a little bit about some of the actions that people can take.
So some of the things we recommend, one thing is to address this is to recommend all associates who generate letters are properly trained on what information is to be inserted. And if you are using an automation in either a letter generation system or a CAG system, make sure they understand what the context of the surrounding text is. Sometimes in those systems, they populate the rationale and it populates into the letter in a certain area, so they should understand the context. The template should be reviewed periodically, even if they're automated, to make sure they're functioning properly. I know there are some programmable pieces of letters just to make sure that that's functioning properly. That should be tested on a regular basis. And also reviewing just the other text of the surrounding letter templates to make sure that, especially when you have non-English letters, that it is being translated properly and everything is reading as it should.
Great. And the second one, sponsors making inappropriate denials. And this was, something you saw in that MedicareRights.org, recommendations. So here again, making sure that, you're not making inappropriate denials. So again, I'll let Margaret just kind of talk a little bit about some of the actions that you can take.
Again, a few things that we can do to help avoid these issues. So the first one is to ensure that the coverage determination team is capturing all the provided information, that they're reviewing claim history and previous coverage determination requests. Also, whenever possible, implement data validation and rules in case management systems, which help the decision and to make sure that all the pertinent information is being reviewed. It's a good idea to review IRE overturn data for insights to see where there was not enough clinical information at the determination or redetermination level to approve the case. And lastly, perform a periodic review of denied cases to ensure all submitted clinical information was considered in the decision, including ensuring the medical director is reviewing all redetermination cases where the initial coverage determination was denied for lack of medical necessity. So basically just a review of current practices and systems to make sure that it's helping to ensure there are no inappropriate denials.
Okay, and then the last one, sponsors failed to correctly determine whether the issue is basically a grievance, an inquiry, an appeal. So categorization, right? And this is something that's always a little tricky. We see it not only in how to categorize a given case, but also when the case gets split, right? For, let's say, a quality of care component, making sure that all aspects of the complaint get addressed. So here again, Margaret, I'll let you, tell us some thoughts and ideas.
So one important area to look at is the single call resolution process. So ideally, these should flow to the A&G team just so there's consistent letter language and to make sure, again, it's included in all reporting. So that would be our recommendation. Also, when training the A&G team, training them on splitting a case. So where there is a case that includes both grievances and appeals, that they understand how to split the case, and provide them with samples of each issue type so that they understand some of the differences. Also, and I think this is really important, consider automated guidance in your A&G system to assist associates in classifying case. If they have some guidance as to the key characteristics of appeals versus grievances, that will also help them in classifying the type of case.
Great. Thanks, Margaret. So kind of two major, I guess, takeaways from that, especially as, people focused on appeals and grievances. One is better leveraging your appeals and grievance data for insights into your complaints, right? In order to, if there's going to be growth in enrollment, the likelihood that there will be growth in appeals and grievances is pretty good, right? And so there's only two ways to combat that, right? Improve the customer service and experience so that you lower your complaint rates and or be prepared for higher complaint rates. So the first point there, leveraging your appeals and grievance data, again, it can give you insights into what some of the problem areas are, right? And if you can improve customer service, that not only will aid in helping you with your stars, help you reduce your complaint rates, but it can help reduce costs, right? When clients are happy, they utilize less resources, so they cost less. In terms of being prepared for an increase in appeals and grievances, obviously optimizing your processes and reevaluating the way that you're doing things, and whether that's, people, process, and technology related to help you better streamline your case handling. And being able to do more with less. And we'll talk a little bit more about that. These are some of the areas that we work with our clients to help them with all the time. At this point, I'm going to kind of turn our attention. So every webinar, we want to try to pick a focus topic. And in this period, we've picked Medicare star ratings and the weighting changes. So the way in which the weighting has changed. So I think anyone that's involved in Medicare Advantage, knows what stars are, but for the sake of clarity, stars are basically a way for CMS to kind of grade plans, right, and give them a way for beneficiaries or enrollees to assess a plan's performance so that they can pick a plan to provide them with their health care. And today, those star ratings really matter, right? For one, 74% of all beneficiaries are enrolled in a 4 or high, a 4-star or higher plan. And that's really shouldn't be any surprise, right? When we go buy something on Amazon or we're going to plan a trip using Yelp or go to a restaurant, we pick the things with higher star ratings, right? So it's logical to think that the same thing's going to occur with health plans, especially as this information becomes more aware to beneficiaries that the star rating exists. The other thing is obviously that there are increases in enrollment. There was a study, I think, where it's something like 2.1 times better net enrollment for plans that are 4 stars or higher. Better retention, better capitation rates, bonus payments, all of these things are tied to stars. And then, of course, the ability to enroll members all year long.
I did, Danielle, I just wanted to kind of interject. So I did read that study, and one thing that did surprise me is that members are 5 times as likely to renew their current insurance plan, whether with a plan of 4 or more stars. I think it is very much a significant impact on retention.
Yeah, yep, thanks. Yeah, that's a great point. I forgot that, and you're totally right. So I think we all kind of know that stars are just, really essential to Medicare Advantage plans. So in terms of kind of the shift that's occurred, there are 46 measures that make up the Medicare star rating. And these pie charts kind of represent the groupings of those measures. And the thing that's really interesting, and this pie chart helps to illustrate, is in the past, the weighting was more on things like HEDIS and HOS, right? So chronic conditions, medical outcomes, not only in the number of measures, but in the weighting of those measures. And now today we're seeing more of a shift towards administrative processes, right, which really affect the member's experience, as well as the CAP survey measures. So we're seeing an increase and more importantly, an increase in the weighting. And so if you look at it now, 56%, so that's more than half of what's being measured is administrative and member experience related. And, as I said, we went from things that were being weighted a 1 to 1.5 to 2 to now being weighted a 4. So they're going to significantly change, your current ratings, especially in these areas. If you're not doing well, you're going to certainly need to change that. The good news, I guess, from my perspective, is that these are measures that you can control. You do have some degree of control over, so that's the good news. So there's really kind of 2 buckets that we kind of put these in. One, the first 3 on the top there, the complaint, appeal, and grievance function is being directly measured by these 3, right? So your appeal decision timeliness, your appeal decision fairness, and then your complaints per 1,000, basically your CTM complaints. The others, while they're not directly managed by the appeals and grievance department or function, the appeals and grievance function can have an indirect effect or benefit on these. And we'll talk a little bit about that as it relates to, grievances. So whenever we're going to tackle a problem, we always look at people, process, technology, right? That's how we look at everything. So in terms of first process, we look at pulling together all the stakeholders in a workshop. So whether we're tackling the appeals and grievance process itself or other processes like customer service and things like that, we start with looking at the process, and we align on goals. We look at who is doing various activities. We look at what systems are involved. And more importantly, we look for the challenges in these processes. What are the problems that are constraining us, or wasteful activities, or areas where we could do better. And then ultimately the outcome of that is going to be opportunities to improve. And we take those then opportunities to improve, and this is done in Excel, right? We just plot them out. So we look at the value or the benefit of what these improvements could do. And those improvements could be anything from, changing standard operating procedures, making changes in people, providing more training, or changing things in our business systems, right? So it could be things of moderate or high value, right? It depends on what it is. And then we look at effort and cost. What is this going to cost us, and what kind of effort will it take for us to implement it? And then we prioritize it. So this chart basically helps us look at what are the kind of best low-hanging fruit opportunities, right? That they're the least effort and cost, but they're going to give us the greatest value or the highest impact, compared to those that probably would cost a lot and the value or benefit really doesn't, justify the activity. So that's how we help our clients kind of prioritize these opportunities. Then, of course, we look at people, and that's kind of all tied together, right? What kind of continuous training can we provide? Always a need for training and ongoing education. How can we look at distributing work differently? Right, so a lot of times we'll work with our clients and, rethink about how work is distributed. And then, are there different ways that we could change the makeup of the team? And the third is technology, right? And we can break this down into a couple areas. One is leveraging the CAG data. So I talked a little bit before about those indirect measures and indirect measures. So from a direct measurement standpoint, right, you should be working with your IT department or your operations team to continuously monitor key indicators. So these three areas, your timeliness, your fairness of your decisions, and CTM complaints, you should be measuring yourself against the STARS cut points, right, as well as the industry benchmarks, right? What are other plans doing in these areas, and continuously monitoring those. And we help our clients, create these types of dashboards, if you will. And then the second is doing root cause analysis on your grievance and complaint data, right? So if you go back again and you look at the measures I was talking about that are customer experience or customer survey driven, right? They're things like access to care, enrollment or disenrollment, I should say, call center and customer satisfaction, whether or not they're able to get help easily. And a lot of this data is within your complaint and grievance data. So you can monitor it to see are complaints getting higher or lower, right? What's the trend? And then we can actually dig into those complaints to see, again, especially if we're categorizing them correctly when we capture them, if it's access to care, what kind of access? Is it related to transportation? Is it related to wait times in the physician's office? Which physicians, right? So where are some of those root cause problems? Obviously, and ideally, if you can, optimize or augment your existing business systems, right? Automation always helps improve processes, accuracy. So things like improving your data validation, making sure the data that goes in is accurate and right, making sure that data is captured, right? Dates are captured, letters are captured, decisions are captured, all of those types of things. Improving integration to make it easier for your complaint and appeals and grievance team so that they don't have to reach into 3 or 4 or 5 systems to get the information they need. Automating your letters, and then providing things like real-time guidance in your business systems. And again, these are all things that we work with our clients to help them with their own existing systems to help improve them. And then, if possible and if necessary, replace your business systems. Go with either, now anymore, some of the newer end-to-end platforms have a complaint, appeals, and grievance module built within them, and or there's specialty software that you can buy that's specific to just CAG processing, which can really make a big difference in your case handling. So at this point, I'm going to turn it over to Kate.
So hi, I'm Caitlin from CAG Solutions, and I will be asking you guys some questions that we have received from our viewers. First question is, you mentioned industry benchmarks when you were talking about monitoring KPIs. I did not realize those were available. How and where do we find these?
Yeah, there is a document published by CMS, and it's a technical note. I think it's the Medicare Part C and D Stars technical notes document. So you can find the averages in that, and then you can use that as a benchmark.
Okay. Question number 2. We have difficulty tracking and reporting first call resolution. How have your clients addressed this?
So I can cover that one. So generically, there's really two options for this. So the first one is that the customer service department or call center can handle it, capture that information in their system, and then the information would then get transferred to the G&A department for reporting. Also, and really we recommend that once it is closed out with the member, that the case is submitted into the G&A team so that they can properly document it, make sure everything is correct, and this way it will be pulled into any automated reporting that comes out of the CAG system. Danielle, do you want to expand on that?
Yeah, just I've kind of seen this done too a number of different ways. I've actually seen some plans directly enter the customer service, believe it or not, directly enter them into the CAG system, although that was quite a long time ago. But one thing to consider is if you're going to capture them in the call center, then ideally you'll have a mechanism to get that data into like a data warehouse, a central data warehouse, so then you can join it with your appeals and grievance data. But in my opinion, I would rather see it get captured in the customer service system and then have that integrate with the complaints, appeals, and grievance system so that those cases are then, pushed into that CAG system.
Okay, thank you. Question number 3. You mentioned CAG specific software. My department has considered replacing our business system, but cost is always the challenge. As a member from CAG, I can answer this one. From my experience when implementing CAG, our cloud-based software, we have seen efficiency gains from 30 to 40%, and there are a lot of cost savings here. If you would like, you could contact Danielle or Margaret from Inspire for a cost-benefit analysis at no charge.
Yeah, we would be happy to do that. Yeah, as Kate pointed out, there's really a lot of different benefits, and it depends. Are you growing where you're going to try to maybe avoid the hire of new employees? Are your complaint rates flat? There's different opportunities, I think. So we would look at lots of different factors and then try to come up with a cost-benefit analysis for you. So
yeah. And question number 4, you mentioned you had clients going through audits. Do you have any insights into the areas CMS was focused on?
Yeah, I could take that one. So again, I'm going to refer specifically to A&G audits. So really what we're seeing a lot is around letters. Okay, so one problem that's coming up is what we discussed earlier about the denial rationale that's not being populated correctly into a letter, where it's not really stated clearly to the member. So that was one thing that we've seen come up. And also incorrect information into the letter. So in one case, there was a tag in a letter, an automated tag in a letter that was set to toggle between grievance and appeal depending on certain attributes of the case. And the tag was incorrect, so it did not populate correctly. So again, that's why we recommend, as we said earlier, just make sure that you QA your templates and to make sure that everything is populating correctly.
all right, great. So that's all our questions. Kate, any more?
Nope, that was it.
All right, awesome. So I guess, I just want to thank you all again for joining us today. We appreciate your time. And, we look forward to our next quarterly webinar. And on the slide there, you could see just our websites respectively. So if you'd like to reach out, you can certainly do that. So thank you again for your time. Thanks, Margaret, Kate.
Thank you.
All right. Bye all.
Bye.